You stretch, you hydrate, you take your daily magnesium pills, and your doctor tells you that all your labs are completely normal. But still, you wake up feeling like you've been hit by a truck. Your muscles ache for no reason. You have a frozen shoulder that refuses to heal, and you constantly feel like your internal battery is stuck at 10%. You're not crazy, and it is not just aging. Here is the medical truth that many MDs also fail to recognize. The problem may not be in the muscle tissue itself, but the mitochondria. Hi friends, this is Dr. Neha Garg here, and welcome to the Healthy Buddha channel. Today we are talking about CoQ10, one of the most researched supplements with over 10,000 published studies. We are going to discuss 4 specific scenarios where this supplement is a game changer. And if you stay until the end, then I will share an ancient Ayurvedic hack that guarantees that your body absorbs the supplement. So what is CoQ10 and why should you care? CoQ10 is an enzyme that acts like your body's internal battery charger. It is present inside the mitochondria, and it is a key molecule that helps in conversion of energy from the glucose molecule into usable cellular energy, or ATP, that is the fuel that muscles run on. But here's the problem. As we get older, or if we are on certain medications like statins, or if we are dealing with chronic stress, diabetes, and inflammation, then our CoQ10 levels, they drop. And when that happens, we don't just feel tired, we feel all that muscle soreness with slow recovery, brain fog, and metabolic sluggishness. But the good news is that mitochondria are trainable and repairable. So let's move on to the 4 scenarios where CoQ10 can make a huge difference in your quality of life. Scenario number 1 is statin-related muscle aches. Let's start with something that I see in my practice all the time. Patients on statins, they come in saying, "Doctor, my cholesterol is better, but my muscles are killing me." And here is why this happens. Statins block the same biochemical pathway that your body uses to make CoQ10. So yes, statins lower cholesterol, but they also reduce your muscle energy production. A large randomized trial showed that CoQ10 supplementation reduced statin-related muscle aches in about 75% of patients. And many meta-analyses from multiple studies have confirmed these improvements in muscle pain, weakness, cramps, and fatigue. But a word of caution, if you're taking statin and are having side effects, do not stop it before consulting with your provider. You can safely add CoQ10 to your daily supplements and see if that helps. Scenario number 2 is the diabetes-related muscle aches. If you have diabetes, then your body is not just dealing with high blood sugars, but also with high oxidative stress that causes mitochondrial dysfunction. That is why diabetic patients often feel excessively fatigued, they have slower healing, they develop muscle inflammation such as frozen shoulder. A large meta-analysis of over 40 trials showed that daily intake of CoQ10 in diabetics improved fasting blood sugars, insulin levels, insulin resistance, and its antioxidant form called ubiquinol was shown to reduce markers of chronic inflammation. It can be safely taken with your diabetic medications and insulin. Scenario number 3 is unexplained muscle pains. Conditions like fibromyalgia, chronic fatigue, frozen shoulder, muscle stiffness. Oftentimes, none of these have a clear structural cause, but many of them share one thing in common. There is poor mitochondrial function and increased oxidative stress. So this is where a 3 to 4 month trial of CoQ10 can be helpful. And recent studies have shown that CoQ10 can help reduce pain sensitivity, lower inflammation biomarkers, improves muscle recovery, and reduces soreness. Scenario number 4 is its protective benefits for the ultimate muscle, the heart. Heart is the most metabolically active muscle in the body and has the highest density of mitochondria to sustain that lifelong activity. A large multi-center randomized controlled trial from 2014 showed significant improvements in the symptoms and functional class for chronic heart failure patients over a 2-year period. So this brings us to the important part. What is the dosage and how to take it? A typical dose of 100 to 300 milligrams per day is recommended. It is a fat-soluble enzyme, so best taken with the fat-containing meal or omega-3 supplements. It is also important to note that CoQ10 is not an overnight fix. You will have to take it consistently for 4 to 6 months before you see any meaningful improvements. Here is the Ayurvedic upgrade that we were talking about. Take it with lukewarm honey water to make it more effective. As we saw in our prior video on honey, honey has a Yogavahi property, meaning it acts as a direct carrier of herbs and nutrients to your muscle tissues, bypassing sluggish digestion. CoQ10 is generally safe in doses up to 400 milligrams per day, but if taken in a dose higher than 600 milligrams per day, then it can cause stomach pain and cramping. It is contraindicated if you're on certain blood thinners like warfarin and certain chemotherapy medications. So check with your provider first if you are on high-risk medications. If your body feels like it's running on low battery, CoQ10 might be just the charger you have been missing. If you found this blend of science and Ayurveda helpful today, then please hit that like and subscribe button for Healthy Buddha channel and tell me in your comments if a trial of CoQ10 has worked for you. Your health is in your hands. Till next time, stay strong, stay balanced.